Each year, the American Cancer Society publishes a journal known as the Cancer Journal for Clinicians. This journal uses cancer statistics from the previous year to predict the statistics for the upcoming year. For the year 2012, the Cancer Journal for Clinicians estimated that 1.6 million people would be diagnosed with cancer. Now, as Penn Staters, we're all aware of what a full Beaver Stadium looks like. What you may not be aware of is that 1.6 million people is the equivalent of 15 full Beaver Stadiums. The journal went on to predict that approximately 34% of these diagnoses would ultimately prove to be fatal. That's more than 5 out of 15 full Beaver Stadiums of people. Cancer statistics in this day and age are downright terrifying. Cancer plays a role in 1 out of every 4 American deaths and is the second leading cause of death among children. Now, like everyone else in the room today, I'm sure, I would love to find a cure for cancer. However, as an engineering major, it's important to me that this disease is being treated as effectively as possible until this cure can be found. My name is Holly Cardillo. I'm a junior in bioengineering, and tonight I'd like to discuss with you why the research and development of immunotherapy as a means to treat cancer is essential to the future of medicine. I would like to do this by first explaining what the most common form of cancer treatment is, how it works, and the effects that it normally has on the body. Next, I would like to describe what immunotherapy is, the success that they've had so far with this treatment, and the possibilities that it holds in the future. So, I'd be willing to bet that everyone here tonight knows of someone who's been affected by cancer. More likely than not, this person was treated with chemotherapy, as this is the most common form of cancer treatment. I believe that chemotherapy's inability to specifically target cancerous cells in the body significantly reduces its efficiency as a treatment for cancer. The way chemotherapy works is that it's injected into the patient's body. From here, it's a common misconception that it spreads throughout the body, searching for and destroying cancerous cells. This is actually not the case. Chemotherapy courses through the patient's body, finding and destroying cells that are dividing or undergoing mitosis. Now, cancerous cells divide at a rate that is much higher than normal body cells, so the majority of the cells killed off by chemotherapy are cancerous. But at any age, we can think of other healthy body cells in our body that will be reproducing. The destruction and mutation of these healthy body cells accounts for many of the negative side effects associated with chemotherapy. So when we think of body cells, no matter what age we are, they will always be dividing. We can think of the cells in our head. Your hair will be growing no matter what your age. You can also think of cells in high traffic areas, so on your palms or your fingertips that are constantly in contact with the environment, as well as cells in your mouth, throat, and digestive tract, where food is always passing through. These cells in high traffic areas are constantly being replaced and replenished. And when this process is disrupted, it can result in sores, so sores on your palms and fingertips, as well as in your mouth, or ulcers lining your stomach lining or digestive tract. One other thing that I found very interesting in my research of chemotherapy is that in a petri dish, doctors can cure just about any form of cancer with high doses of chemotherapy. These same doses cannot be injected into a patient's body, unfortunately, because it would result in the death of too many healthy cells. Therefore, chemotherapy becomes sort of a balancing act for a doctor. How many cancerous cells can they kill off without destroying too many healthy body cells in the patient? This is also the reason that chemotherapy is most often administered as a cyclic treatment, with periods of rest in between injections for the body to repair and replenish these healthy cells that were destroyed. Doctors at the Fred Hutchinson Cancer Research Center started to notice how many cancers would originally respond to chemotherapy, but stop responding before all the cycles could be carried out. When they investigated into this, their findings were published in the Nature Medicine Journal of 2012. What they found is that chemotherapy was being injected into the body. It was often coming into contact with fibroblasts or connective tissues, and these cells fall under the category of they will always be dividing no matter what your age. When it came into contact with these healthy fibroblast cells, it didn't always kill off the cells, but oftentimes resulted in a genetic mutation of their makeup. This mutation caused the overproduction of a protein known as WNT-B16. And after multiple cycles of chemotherapy, this protein could sometimes be found in amounts 30 times greater than normal. The issue with this is that this protein, WNT-B16, is known to promote cancer cell growth and invasion into surrounding tissues. So in summary, the chemotherapy is being put into the patient's body to fight off their cancer. It's causing this mutation within their healthy cells, resulting in the overproduction of a protein which fosters the cancer cell growth and proliferation. Researchers estimated that this was the case in almost 80% of metastatic breast, lung, and colon cancers. So essentially, the chemotherapy in many cases was causing resistance upon itself. So what if I told you there was another form of treatment out there, one that specifically targeted the cancerous cells? What if I told you that doctors and engineers had paired up and could create a small army, per se, in the patient's body to seek out and destroy the cancer? This sounds pretty crazy, doesn't it? But it's not far from the truth. Dr. Carl June of the University of Pennsylvania, along with a team of researchers, was able to identify a marker protein that sits on the cells of B-cell cancer, or leukemias, cancers of the blood. You may have heard of acute lymphoblastic leukemia or non-Hodgkin's lymphoma, as these are some of the most common forms of B-cell cancers. In fact, B-cell cancers are the most common form of cancer found in pediatric patients. And when found in adult patients, these B-cell cancers have a less than 40% survival rate. Dr. June and his team identified a protein known as CD19, which sits on the surface of these infected B cells. Next, they were able to genetically engineer a virus to recognize this protein. This virus was then injected into a patient's white blood cells, or T cells. These are cells of the body's immune system that would recognize and fight off invaders. Once the virus was paired with the job of the normal white blood cell, they were put back in the body and then knew to fight off and destroy cancerous cells within the body. One thing that's really neat about this is when these engineered cells were put back into the patient's body, they then reproduced as they normally would. So although doctors infected only a small number of white blood cells, in just a few weeks, amounts over 100 times greater could be found within the patient's body. It's also estimated that each engineered white blood cell can kill upwards of 100 cancerous cells. So the effects of this are truly astounding. Dr. June's team then paired up with Dr. Stephen Grupp of the Children's Hospital of Philadelphia, along with doctors at Memorial Sloan Kettering, and created what became known as the CLT-019 clinical trial. This clinical trial employed 12 patients that were at their end stages of their B-cell cancers. I'd like to now introduce you to Emma Whitehead. She was the youngest of these 12 patients in the trial. By the age of 7, Emma had already relapsed twice from her leukemia, and doctors were out of treatment options. Emma's T cells, along with the 11 other patients, were filtered out of her body and injected with an engineered virus. In this clinical trial, they actually used an engineered form of the HIV virus. Although it had been changed in such a way that it could no longer infect the patients, it still harnessed a lot of the destructive power of HIV. On April 12, 2012, Emma's T cells were injected back into her body. The CLT-019 trial went better than doctors could have expected. I would now like to introduce you to Emma today, just merely a year and a half later, happy, healthy, and cancer-free. Emma shared these results with 8 other patients in the trial. What's really cool about this treatment is now Emma goes for regular checkups, and the engineered white blood cells are still very present in her body, so that in the unfortunate case that her cancer would ever come back, they still know to seek it out and destroy it. So now you're probably thinking, wow, this is really cool, and it actually works. But we all know B-cell cancers is just one of the many types of cancers out there. So does it have any other possibilities? When Dr. Richard Bressler, the Chief Health and Medical Officer at the New York Times, was asked this same question, he responded, absolutely. The possibilities for this treatment are truly endless. Once doctors can recognize marker proteins on other cancers, such as the one shown behind me, viruses can be trained to recognize these and fight off these cancers as well. In fact, researchers at the UC San Diego Moores Cancer Center have already had success fighting off glioblastoma in mice. Glioblastoma is one of the most deadly forms of brain cancer. So as you can see, this is a truly revolutionary breakthrough for the medical field. Unlike chemotherapy, immunotherapy is able to specifically target the cancerous cells, causing less harm to normal body cells and therefore significantly decreasing the amount of unwanted side effects. Immunotherapy also uses the patient's own cells, introducing very few foreign invaders into the body and significantly decreasing the chance of rejection. Finally, this is a very versatile treatment. Many different viruses can be engineered to recognize all sorts of protein, so cancer can be fought across the board. And children like Emma can grow up to lead happy, healthy, and cancer-free lives. Thank you.